Hi everybody, Dr. Misty here. Thanks for joining in on Wellness Wednesday. Today I wanted to, instead of giving you guys a little bit of medical information, I wanted to share with you some of my story and what I've experienced and what I've seen patients experience who have complex chronic issues. So this is really such a sad thing because it's so common what patients go through. Sorry, I always do this. This is the time of the video I take off my glasses because I can't get through the glare. So this is so common that it happens. It makes me so sad and so frustrated for patients because this can truly leave a patient feeling hopeless, more depressed, feeling helpless because they don't know where to go for answers, and is really not productive. Okay, so a patient, typically this is a patient with chronic fatigue, chronic Lyme disease. There's a multitude of things the person's has. It could be depression, it could be fibromyalgia. But a patient presents to their primary or medical doctor, and just to be clear, this isn't necessarily against a specific profession, but in general, this has happened with natural providers too, with some patients, but or specialists. But just in general, like it's been like the gatekeeper is the GP, right? So patients go in, they say, "Doc, I don't feel good. I'm just tired all the time. I feel puffy. I feel bloated. I feel whatever I feel depressed." Doctor says, "Okay, let's run some tests," right? So runs a slew of tests based off of the 5 or 10 minutes that they spend with you and your intake, right? Tests come back. No, it's negative. Well, doc, did you check for, did you check my thyroid? Did you check this? Did you check that? Yeah, we checked all that. You're good. Your tests are negative. Okay, well, you're fine. I don't feel fine. I don't feel good. There's got to be something going on. Well, your tests are negative. You're fine. It's in your head. You must be, depressed. Are you're not getting out and exercising as much. Kind of this patient blaming type of situation starts happening. This is actually, and this is like hardly ever. I don't feel like I've seen this anywhere. And I feel like I might get some controversy with this, but it needs to be out there because patients need to understand that this happens. Sometimes, there are physicians where instead of saying, "Hey, I don't know the answer to that, let me look it up for you," or saying, "Hey, your tests are coming back negative, let's check some other things. I can see that you're not feeling good, and I want to help you. Have you tried XYZ? Have you experienced this?" And digging more, or making a helpful referral to the patient, or simply saying, "You know what, I'm not really sure what's wrong, but maybe let's look into some further tests, or where would you like to go with this?" Instead of saying that, the patient is actually being gaslit. And they're saying that gaslighting is a form of emotional abuse and psychological abuse, meaning that what you are experiencing and your emotions are being shut down. So what you're experiencing, because the other person is basically what their tests said are negative, it means that you're fine. There's nothing wrong with you. It couldn't possibly be the fact that they didn't search enough. It couldn't possibly be the fact that there's another way to look at things. It's that, nope, I didn't find an answer, so there's nothing wrong with you, so it's all in your head, right? So that is patient gaslighting. And it's really sad to see that happen, because what that happens, the patient goes to the doctor's office to get some help for their issue, which, by the way, there's always an underlying, always listen to your body. There's always an underlying issue there. I can't tell you how many times this actually happened to me personally, in multiple different ways. At other physicians when I was first getting diagnosed with celiac disease. I had been told that I was just overweight, I needed to exercise. it turns into a victim blaming game. Oh, I checked you for Lyme. Oh, I checked your thyroid. By the way, checking just your TSH is so not the base. That's like the bare minimum check for thyroid. That doesn't check for autoimmunity. It doesn't check for a ton of other things that cause whole body fatigue, depression, fibromyalgia type of symptoms. Okay. So, if your general doctor you've gone to them and that's what's come out, typically, you may have come back with, hey, can we check XYZ? Your doctor may be open to the fact that, okay, yeah, let's try that. Let's check some vitamin deficiencies and we'll go there. We'll check your vitamin D levels. Maybe that's what it is, right? Hopefully, if your doctor is a good doctor, they'll say, you know what, I'm not really sure what's going on, but let me get you some names of people that might be helpful for you. Let me refer you to such and such type of person. This might be helpful, but I'm just not sure what the tests that I'm running are showing me negative. I believe you. I believe what you're saying and you're experiencing. I just don't know what the answer is. Okay, so that's an appropriate response because they're not denying what you're feeling. They're not denying what you're experiencing. They're just saying, hey, I ran some tests. This is pretty much all I got. I'm not sure what the answer is. Let's get you more help, right? So that's good. That's what you want. So typically and time again, when I've seen patients, some people come in tears. Some people I've seen are like years and years and years upon like, why is this happening? What is wrong with my body? Why can't anybody give me an answer? And here they go around in a loop in the medical system. And it's not to deny the medical system of their validity and their ability to help other people, okay? Because every system has a role, okay? Medical is excellent at helping with especially emergency situations. I don't personally feel that the medical system is helpful in dealing with chronic issues and chronic health issues. There are some medical physicians who will actually state this because they're more trained in an acute setting. They're trained in a hospital setting. They're trained in those acute settings. So if you are somebody who is feeling defeated or hopeless because you've been through the medical model, and you might have because of their training and because of not just because of the medical, it's because of the mind and the emotional state of the actual physician, they will they can't be wrong, or their perspective is the only perspective in medicine, so the problem must be you, and it must be all in your head, right? So that isn't you. That's the physician, okay? And it's really important that you know that and keep searching for answers for yourself, okay? Because there are numerous other types of medicine out there. There's Ayurvedic therapies, there's acupuncture, there's chiropractic, there's naturopathic, there's osteopathic, there's multiple different ways to look at health, okay, and break it down. So personally, I am a functional medicine practitioner. I was previously a chiropractor and clinical nutritionist as well. So to me, seeing patients in a chronic pain state was something I saw regularly, right? And so over time, especially with my own story being that the more testing I did, I literally had to say, you know what, I know I don't feel well, and I'm going to get to the bottom of it because, I don't want to live my life like this, right? Understanding this is where it really hit me how much there are multiple roots to problems, and how extensive and expanded testing is so important. So expanded testing allowed me to understand that not only did I have a large immune dysfunction, but I actually had celiac disease, okay? And at the same time, I had a multitude of inflammatory issues. I had mold toxicity from my bedroom. I was breathing in mold from when I had it when I was living and had my furniture at a damp place. It had mold on the back of it. And so mold toxicity could absolutely bring about chronic fatigue and fibromyalgia symptoms. By the way, it can really exacerbate that. And so it's important for you to understand, and basically my basic purpose of this video is to help you understand that your instincts and your perception of what you feel in your body should never, ever, ever be doubted. And you are a very powerful healer yourself. So the best doctors are going to be guiding you, not gaslighting you. Okay? So please know that. And that's not to say I'm the best doctor, because believe me, I've made plenty of mistakes, unfortunately, because I'm a human being. But I do always keep my patients at the center, and the reason why I practice and why I'm there. I'm there to help them. I'm there to help them to feel better and get answers. But it's important, and I always tell patients that, we are our own best healers. Now, yes, we can reach out to help. Yes, we can utilize medication. We can utilize herbs. We can utilize all these things. But we also have to listen to our intuition and body and energy as well. Because healing is not just about the physical body. It's also about energetic healing. Okay? And so what happens to those patients is actually, now that they were sick, they went to reach out for help, and now they're in a worse state. They're in a worse state because now they're feeling like there is zero hope. Okay? So this is the absolute, if you are somebody who has experienced that, I truly understand how challenging that can be, to feel like, what is wrong? Why is my body feeling like this? And where's the help? Where can I find, So if that's you, comment below. You can message me also. I work with patients who experience these types of ailments, and it's truly, a lot of it is that going around the medical system is really, they're looking for disease, not necessarily dysfunction. And so sometimes with chronic fatigue and fibromyalgia, the problems really lie in dysfunction of the body. Okay? And so patients with having a high level of mycotoxins on top of having gut issues and a lot of pathogens in their gut, whether it be a parasitic infection or whatnot, or they have a lower immunity, they have a high level of inflammation, they have an inflammatory diet, there's a multitude of different things that could be taking place. There's some people who have extreme vitamin deficiencies. This is where a functional medicine is really powerful, because the gap between acute disease and then with chronic disease, in the medical system, it's disease and healthy. You're either diseased or healthy. But with chronic disease, there's research that shows us this can take 30 to 40 years to develop chronic disease. So how does a patient go overnight from healthy to diseased, right? Just by a diagnosis? No, it takes time. It takes dysfunction, years and years and years of dysfunction. So it's really important, in my opinion, to look at not only diagnosis, but dysfunction and how your body systems are working together. Okay? Usually the root cause of those chronic ailments is within the dysfunctions. There's usually multi-levels of dysfunction. So if you are somebody who has had that happen, again, I truly understand, like, the frustration. Don't let that situation drop you into feeling hopeless or depressed. Okay? Continue your search to look elsewhere. There are answers. And usually it's not necessarily a diagnosis that you're looking for, but more on the lines of dysfunction. Okay? Some examples of that are, I've had patients with severe vitamin B12 deficiencies. Sometimes that shows up as chronic fatigue, because it shows up with anemia, specific types of anemia. It also shows up as a neurological deficit, like pins and needles in their hands and feet. There could also be B vitamin deficiencies, other types of B vitamin deficiencies that affect our mitochondria, which is our cellular energy workhorse. Okay, you need specific vitamins to fuel and burn energy properly, as well as detoxify your body. So if you're not getting enough, you're not absorbing the vitamins, if you're not taking in the vitamins, you're going to have a problem. And if you're not transporting the vitamins properly into the specific parts of the cell, you're going to have problems with the function of the cell. So functional medicine, we're not just looking at a disease in general. And disease, by the way, when we break things really far down, we're looking at organ systems, cardiovascular disease, right? Lung disease. We're looking at diseases of organ systems. We're not necessarily looking at cells or dysfunction of the cell. So what makes up the organ system is the organs. What makes up the organ is cells, right? And what makes up the cells is the organelles of the cells and the atoms, etc., right? So this is where I really specialize with people, is understanding the cellular dysfunction can lead to the organic disease, okay? And so, my job is to be a detective in and other functional medicine doctors, the way we look at the body is more of upstream medicine. Like, hey, we're going to be a detective. We're going to look around at the cellular health of what's going on and understand what's going on with this person's body, and if we can figure this out. Now, sometimes there are multiple different things. Our body is we aren't static beings, meaning we're not still. Our blood chemistry changes, our posture changes, our muscles change, our digestive, we are consistently utilizing energy, and we're consistently in trying to create homeostasis within our body. Okay, so it's important that we not just look at things as snapshots in time, but also understand that our body is working together. All of our systems are working together. All of our systems are working together with our organs through our cells to have homeostasis and health, right? So it's important to not just look and be like, oh, good, okay, where's the disease, right? We have to also look and back up a little bit and say, where's the dysfunction that could lead to the disease? Because we don't want to end up with the disease, right? The hardcore diseases, right? So moral of the story, I'm on a soapbox now. Moral of the story with this is trust your body. If you haven't experienced this, if you've been around the medical community and you have reached a point of defeat, you might feel hopeless. You might feel like, I don't even know where I'm supposed to go. What am I supposed to do? Just live with this? Just suck it up and live with it and, be depressed all the time or be on medicine or, that's where you may need to change the lens a little bit and look in a different way at health and in a different system. So that is functional medicine. It's a different paradigm of medicine. I would also suggest that trying things like acupuncture and things like that are really powerful because they're looking health. Acupuncture is very energy based. It's based off of energy and chi flow within the meridian points of our body, and it's been around for thousands of years, and many people have experienced a lot of amazing relief from acupuncture. So I just want to validate you if you have experienced this, especially if you are a survivor of developmental trauma, and this really can set off your radar and set off anger inside. If you have experienced that amount of chronic trauma or gaslighting throughout your youth. So if you need help in this realm, this is who typically that I work with. I would love to help you or sit down with you. You can find my website at www.newhorizonchiro.com. I typically do an initial consult with people and figure out if and how I can help, and send them for extra labs. The labs are so powerful. The functional labs are so powerful and so eye-opening because they give a patient the validation that they're not crazy after being told so many times, it's in your head, So the functional labs were a huge eye-opener for myself as well as many other patients that I've worked with throughout the years. So if you need my help, I'm happy to assist you and be there for you. I do virtual consults. So I'm Dr. Misty Kosciuszko. I hope that you got some hope out of that. I hope that you won't stop being an advocate for yourself and your own health. You don't have to just suffer with it. You don't have to just live with it. There are ways to feel better. So I will see you next week. Thank you so much for watching, and see you next week.